We're pleased to welcome to the main stage If Your V Could Talk, presented by Hina Seth.
So hi everyone. Thank you ladies for coming and joining us here. I think it's such an important subject. I'm so glad you guys came to listen. And so let's get started. So how many of you, if you could have a talk with yourselves down there, a little chit chat, a little coffee talk, what would your V say to you? Would it say, I am so happy, I'm feeling like Pharrell down there, everything's been great, sex has been awesome, I got no problems, life is grand? Now, many of you may, but many of you may not. Now, number two, would your V say, things haven't kind of been a drag lately. I'm kind of angry, I'm irritable, maybe just not feeling comfortable these days. Sex kind of hurts, and it's not like it used to be. Or would your V say, number three, would it say, every time you cough and sneeze and laugh, it's a mess down there. I need a quicker picker-upper fast, or I gotta go all the time. Or number four, would it say, things have been kind of crowded lately. There's all sorts of things in there that shouldn't be and hanging down way low, and it's bumping up against me all the time. Or number five, it would say, all my neighbors, like the bladder and the rectum and the stomach, we've all been talking, and none of us have been feeling great lately. So, raise of hands if it's number 2 through 5, if you guys might be feeling that way lately. Okay, so, and many of you may not even know what your vaginas would say about you. However, I am Hina Seth. I am a pelvic floor physical therapist located in Narberth, Pennsylvania and Center City, Philadelphia. And no, I do not talk to vaginas all day, but I'll tell you in a little bit what I do. Now, how many of you guys have heard about something called the pelvic floor? One person. Okay, so the pelvic floor, another word for the pelvic floor that often people kind of confuse with is the word Kegel. How many of you guys have heard of the word Kegel? Okay, many of you have heard of the word Kegel. So Kegel is actually a name for basically a way to contract the muscles that are inside the pelvic floor. Okay, now, how many of you guys think that the Kegel is one big muscle? I want to make this interactive, okay. So, the muscles actually in this area, 16 muscles are located in your pelvic floor. It's amazing. There's that many muscles. And each of those muscles could be doing something different. And so, these muscles could tell you your history. They could tell you so much about you. They can tell if you've had constipation. They can tell you if you've had traumatic births. They can tell you what you've been through, if you've had tailbone issues, if you've had abdominal issues, if you've had hip pain, if you've had back pain, because a lot of these muscles can actually be involved in this area, okay? And it's often been told that this area, out of more than any other area in the body, is where it can actually read what is going on inside of you. It can actually tell you about your inner state or your inner being. And often it's actually been said that it can actually be a reflection of your soul. And can you guys still hear me? Yeah. A reflection of your soul. And so basically, things that are going internally on with you, whether it's been trauma, stress, worried, anything like that, it can actually manifest in this area, okay? So, I'm going to show you a little model, actually, of what these muscles look like. So, here is the pelvis, okay? So, I don't know if you guys have any anatomy training, but basically, this is a model of the pelvis, okay? And you've got these two bones right here, okay, which are actually these bones right here, okay? You've got the pubic bone right in the front, which is this bone right here, and then you've got this other bone right here, which is your tailbone, okay? And these muscles basically span from your pubic bone all the way to your tailbone and in between your sits bones. So right now, you guys are actually sitting on your pelvic floor, And this is basically, when people contract these muscles, this is what's called the Kegel, okay? And these muscles can basically become tight and irritated or loose and weak in someone, okay? So, now, before I basically tell you what I do, I'm going to tell you one other thing, which is sad because in much of our society, most people don't actually talk about this area. You don't hear your healthcare practitioners, if you've had issues down here, they don't come forward and talk to you about these things sometimes. And maybe you guys don't even talk amongst yourselves or even amongst your girlfriends about what might be going on. And it's too bad because I think society has kind of tabooed this area a little bit. But what's even more ironic is that there is a nerve that goes through this area. It's called your pudendal nerve. And the Latin meaning for pudenda is actually shameful. So that's kind of ironic that this nerve in this area has actually been named after the Latin word for shameful. But it shouldn't be, because this area is so important for so many different things that I'll tell you in just a minute. Okay, so we're all going to basically, what I do, okay, myself as well as my colleagues, we're part of Rebalance Physical Therapy, where we treat a lot of these dysfunctions in addition to hip, low back pain, and various spine pains, and we use lots of different techniques. But the main point is for a lot of these things that I'll be talking to you about, there's actually treatment for these areas, and this is what we do. So, let's do a little exercise. So, I want all of you guys to basically think about if your vaginas could actually sip a martini. I know it sounds very strange, but this is going to help you demonstrate what a contraction or a Kegel is, okay? So I want everyone to kind of think about that and imagine another way is if you could connect your tailbone to your pubic bone in a line, okay, going from your tailbone to your pubic bone, I want you to do that and see if you feel something pulling upward towards your head. Yes? Kind of? Okay, so that is what's called a pelvic floor contraction. And a lot of people use that as a strengthening exercise, but ironically, there's a lot of people who walk around like this all the time. And it could be from many different things, such as when we were younger and our mothers used to tell us to hold our tummies in, or because we want to look really good and we guard and hold our stomachs in anyway. Or you might be going to Pilates, or you might be going to, I don't know, some abdominal strengthening class or a glute strengthening class. And if you over-exercise these muscles, it can actually further tighten these muscles if you're already kind of doing a Kegel all day. And when that happens, it can actually cause pain and irritation with lots of different things, with sitting, with having intercourse, with having GYN exams, with, constipation is another thing that a lot of people deal with. Irritable bowel syndrome is another area that these muscles can be involved. There's a lot of other GYN diagnoses, which I'll kind of list in a minute. There's many different things that it can cause. And it can also create issues in the low back, in an area called the sacroiliac joint, or even something called sciatica, which many of you guys may have heard of. It can play a role in that. Because again, remember, there's 16 muscles in this area, okay? Now, what I want everyone to do is I want you to push out as if you're just gonna start to urinate or have a bowel movement. And what you should feel, okay, you can do it subtly, but what you should feel is you might feel a ballooning out down below, okay? And that is what's called a reverse Kegel, okay? Or what's called a pelvic floor drop, which means these muscles are actually relaxing. Now, in that case, okay, sometimes people are walking around with their pelvic floors in the bulgy or the anti-Kegel position. And what happens is typically, okay, not all the time, because you'll actually see a lot of athletes, okay, that play high impact sports actually have weakness in these muscles. But oftentimes after you've had children, this area, just imagine having a baby, whether it's a C-section or it's a vaginal delivery, this is a highly traumatic thing that your body goes through, especially these muscles, because this is what the baby comes out of, okay? And when these muscles are traumatized, most of the time, most women don't take the time to actually exercise these muscles back into shape, okay? So you can either have someone walking around with really tight muscles in this area, you can have people walking around with a lot of looseness in this area, or you can have people walking around with something called a mixed pelvic floor, which is, remember, 16 muscles, some of them can be tight and some of them can be weak, okay? And so it's really important to know what's going on with your bodies down there. And again, going back to the shamefulness of this nerve, as well as the whole idea behind why our physicians and why us as a society don't talk about this stuff with each other. It's so important that we do, because teenagers all the way to, our seniors are dealing with various different issues in this area. Teenagers are dealing with a lot of different issues, such as pain with intercourse, pain with using a tampon. They go to have their first GYN exam. It's really uncomfortable. They might also have pain with sitting. Even teenagers might have a little stress incontinence, which means that when you cough or sneeze or you laugh, you might leak a little bit of urine. And this can be treated, but so many little girls are embarrassed to talk about this or even bring it up because they don't know what to expect. Some of these girls have never had intercourse before, and this is the first time, and it should be something amazing for them, and it unfortunately isn't. So then that affects their own personalities in terms of, are they am I normal? Is this right? Is it wrong? And then they don't talk about it to either their family members or their girlfriends or their physicians, okay? And then as you pass into possibly motherhood or in your 40s, then things just kind of start to change down there, don't they? Now, look to your left and look to your right, or look behind you, okay? 1 out of 3 women in the whole world, okay, 1 out of 3 women, 30% of all women at some point in their lifetime will or is dealing with a pelvic floor issue. Whether it's a pain issue and everything's too tight, whether it's an incontinence issue and things have gotten a little weak, or there's something called a prolapse, which is your organs start to descend. And there's also, other issues that people don't even realize, like a lot of gastrointestinal issues, like constipation, irritable bowel syndrome, abdominal pain, that people don't realize 65% of the time that there's a gastrointestinal disorder, 65% of the time these muscles are involved, okay? So I want you to look at this again, is that if you look down here, okay, these muscles, look at the 3 areas that they go through. There is the urethra, which is what you urinate out of. Here is the vagina, which you have the baby as well as you have intercourse. And here is the rectum that you have bowel movements. So you can imagine if there's any changes in these muscles, then you're gonna have issues with all of those organs that span upward, okay? Which is gonna include your bladder. So people can have bladder frequency, urgency, incontinence. They might even feel like they have a urinary tract infection sometimes, okay? To any issue around the uterus and in the vagina, okay? So pain with intercourse again, pain with tampon again, pain with GYN exam, pain with sitting, okay? Even external pain around the vulva. Some people even think that they have chronic yeast infections all the time, even though they've gone to their GYNs, they've been treated, but they're still uncomfortable down there. Well, these muscles can be involved. They can actually cause a lot of those symptoms that people might be having. And then in the rectum, colorectal issues. So many people might be going to their colorectal doctors thinking they have hemorrhoids, or there's a constipation issue, which they go to see to their GYN or their gastrointestinal doctors, or irritable bowel syndrome, okay? We're all thinking it's food. Sometimes it might not be, but these muscles get involved because there's a lot of nerves that talk to each other in your gut, okay? And they all can send muscle or signals down into these muscles, and they become dysfunctional, okay? Now, again, what's so crazy about all of this is why is it so important for you guys to know what's going on down there? Well, it's because this affects so many people's quality of life. Wouldn't you agree? I mean, we don't like to talk about it. We might go to the bathroom and be like, oh my God, I can't believe this happened, right? Fecal incontinence happens, urinary incontinence. We can't believe it, but it's really difficult for our society to kind of talk about it. And then if you do bring it up to your doctors, either they don't know a whole lot about it, or they don't really know what resources to point you through, or they tell you to it'll pass, it'll be okay. And we hear this all the time. Now, how do I know about all of this? Well, I've been treating this for 15 years. And my colleagues and I, we basically have worked at one of the top healthcare institutions in Philadelphia. And I go around and I actually lecture to all the residents and attendings around all the major university hospital systems, to their GYNs, to their gastrointestinal doctors, to even physiatrists, as well as GYNs, if I didn't say that, and urologists, to basically educate them that this is a big issue. Now, the good thing is many doctors are starting to catch on, and they're realizing that this is a really important area that women need to know about and be educated about, and now they're starting to point them in the right direction. But there's only so many physical therapists that actually specialize in this dysfunction. And so my job and my passion is actually educating the community that there is help out there. And so if you guys know, either you guys know of someone, your mothers, your daughters, your friends, other family members that might be having an issue here, that they can get help and there's a place to go. And so, we all need to sit down and we need to kind of have a chit chat with our V's down there and kind of find out what's going on. And then know, okay, if your V's complaining and they think they're having some type of personality disorder of the 5, or actually the 4 that I described, number 1, you're in a good place, okay? Then, it's really easy to get in contact with us and we can help point you guys in the right direction if it's not us that can help you. So, do you guys have any questions at all? No? Okay. Yeah. Yes. Okay. So, right now, when I step off stage, I can talk to you individually and give you our contact information. But I'm so glad you guys came for this talk because it really is so important and it needs to gain a lot more awareness. And we're passionate about it. So what we specifically do, okay? So you as a person, the big thing is you just need to know what your signs and symptoms are, okay? So I'm going to this is actually a good segue to kind of tell you what some of the symptoms could be, which I kind of went over some of them, okay? But again, I said, if you have pain with inserting a tampon, okay, pain with a GYN exam, pain with sitting, painful periods, maybe bladder pain, anything that's associated with pain, urinary frequency or urgency, okay, any pregnancy-related pain, something called a diastasis recti. Have any of you guys heard of a diastasis recti? Okay, well, it's basically splitting of the abdomen after you've had children, okay? So you get a lot of weakness in the abdomen, okay? Any type of abdominal pain, any type of pain that involves around endometriosis. I don't know if any of you guys have heard of that, and even IBS. So all of those that I just listed, okay, those can be associated with a lot of tightness in the muscles down in the pelvic floor. So the other ones that can also be associated with that is if you've got low back pain, hip pain, sciatica, sacroiliitis, constipation, pubic bone pain, okay? Even patients with fibromyalgia can actually have issues down in the pelvic floor, okay? So, which is all tightening. Now, if you truly have incontinence where there's a lot of urine that might be leaking, okay, and you can't hold it back, or something called a prolapse. And what a prolapse is you might feel something is uncomfortable or foreign in the vaginal area. Something feels heavy and it wasn't there before. It's almost like, whoa, what's that thing down there? Okay? Then that could be associated with a lot of laxity or a lot of weakness in the pelvic floor. Now, if you have a combination of both, then you can have what's called a mixed pelvic floor, okay? The way we determine this in the clinic, okay, and by the way, you can come see us without having a prescription from a doctor, but you can come see us and we will actually evaluate that area ourselves, kind of like a GYN exam, but it's much more delicate. We don't use speculums, we don't use anything like that. But in addition to looking at the muscles internally and feeling what each muscle individually, and we take the time and look at each muscle individually, okay, we can tell whether it's tight because it will be very painful and it'll actually feel very tight, or we'll take a look at it and be like, wow, there's a lot of laxity there, and we'll actually have you do different types of contractions to figure out whether there's weakness there. And then we'll base basically a plan of care around that. But in addition to that, you wouldn't believe it, but there's a lot of things from head to toe that from the outside, there's a lot of muscles that are connected in and around the pelvis, right? You heard of all the old nursery rhyme that the foot bone is connected to the ankle bone and the ankle bone is connected to the knee bone. Remember that old childhood song? Well, it's absolutely true. But in society today, we're all treated in pieces, right? Everything's so specialized. Have any of you guys gone to physical therapy before for anything? Okay. So if you go there, usually if you have like a knee problem or a shoulder problem, most of the time they're concentrating on those two problems. But people don't realize that these joints are connected to everything else. So when people are coming in to us to be treated for pelvic floor issues or even low back issues, which is a common one, or hip issues, this is an area that we actually look at. And we say, let's comprehensively look at everything, because chances are that back pain that hasn't resolved, it could be because the pelvic floor, there's an issue there, because inside it's connected to the pubic bone, which is connected to the hip bone, which is connected to the backbone. So you have to look at everything very globally and holistically in order to treat even this one area. So we look at people from head to toe, we look at all the muscles, we look at the myofascia. I don't know if you guys have ever heard of myofascia. The myofascia, which is basically, the myofascia is the tissue that starts underneath the skin, and it surrounds every single muscle, every single organ, and every single part of the body, so that our organs aren't crashing into each other. It kind of is a flexible material that keeps everything organized, but it's also flexible so that we can move. But sometimes that fascia can get restricted, and that can cause pain as well, in addition to these muscles all around the inside and out. So we look at all of that and figure out, okay, is it tight? Do we need to then do what's called manual therapy, which is either massage, trigger point release, myofascial release, and then we say, okay, now you're ready to do the strengthening of these muscles, because now everything's in a better alignment. Does that make sense? Okay. Yeah. Oh, it's time. Oh, 5 minutes. Okay, go. Yep. Yes. Okay. So that's classic. It's called key in the door syndrome. So the question was, when you basically get home and you get out of your car and you feel like you have to go to the bathroom and you put that key in the door, it's like you got to run to the bathroom, right? Well, many of us have experienced. Is it in your head? Well, funny you should say that. It can be. It can be. Sometimes these muscles can really be involved, and you have to look at it, because it could be tightness in these muscles or weakness. You can have weakness in the front part of the muscles. Remember, again, there's 16 muscles, right? Or you can have tightness in the back. And depending on what's going on, you treat that. But the other thing you have to treat, it's called behavioral management of the bladder. Because if you think of the bladder like a little baby, okay, every time you cave in to going to the bathroom, it's like giving candy to a baby. They want it every single time. So your bladder likes it when you run to the bathroom. If you're one of these people who know where every single bathroom is on the interstate, okay, because you can't make it in a 2-hour drive, okay, then it's usually, there could be a behavioral component, and we have to retrain the bladder to understand how to fill again. So that's part of the treatment regimen. So there's ways where we call it timed voiding. So you basically feel like you have to go to the bathroom, but there's different, believe it or not, there's different breathing techniques that we can teach you to quiet the bladder down. And people's instinct sometimes is to clench really hard before they run to the bathroom. But in reality, sometimes, not all the time, but many times, actually letting go and doing some deep breathing actually will trick the brain into not giving that signal to the bladder, so you can make it and not have to run to the bathroom. Not holding the breath, no. You never want to hold the breath. Holding the breath will actually make it worse. You want to breathe. So take nice deep breaths. So maybe do a helpful tip is to basically, your natural tendency would be to kind of clench, right? Clench these muscles to hold your urine in. Okay. So do one of those and then let go and do a couple of deep breaths, okay? And see if it actually quiets down. And sometimes that can help. Now, not all the time, because again, sometimes you actually might need treatment to treat it, okay? Meaning like you might need physical therapy in this area on top of the retraining of the brain to your bladder. And that can help a lot. Yeah. Okay. Well, I'll feel free to talk to me. I'm gonna, come down here with all of our information, and I'll be happy to answer any questions for you. Okay? All right, guys. Thank you.